I need to be careful how I say this, but one of my sort of criticisms of university research, not all of it, but some of the university research that is conducted, at least in the US, is that it is it's scientifically interesting, but not necessarily commercially interesting. And so what happens is, at least in the US, there's a lot of US, there's a government grants, they fund a lot of this research, and some of it is valuable, some of it is necessary, but some of it is just it's just not commercially interesting. It's not something that a pharmaceutical company would pick up. Um, and so to your point, it just, leaves you to wonder, what if that grant money was spent on something else? Would we as a society be better off? And so what you're saying, it strikes a nerve with it strikes a chord with me because I think governments should try to be a bit more driven by projects that are a bit more commercially interesting as opposed to just scientifically interesting. So,
That's a big problem. I think the government know that, but it's hard to for the execution. In China, 10 years ago, it's not very difficult to get a lot of the financial support from the government if you have a good work experience. For example, if you come from a big farmer or have a PhD and the study the experience in the West, or but and if you have the work experience in the big pharma, that will be best. And you can got a lot of the money from Chinese government and to fund a startup in here. But finally, the Chinese government fund is not a good way because they do not have a lot of the experience to lead a company, and
mm,
especially
mm, mm,
they achieve don't have the achievement to how to make a drug launch, something like that. So
mm, mm, mm.
they invite social investor into their evaluation process, and only when the social investor they said, oh, that project is okay, and then the government will supply the financial support. If not, they will not give the money to them. But
Mm.
that the I think the reality is more complicated, and there's still some ways to bypass the guidance, something like that. And I think for the academic driven research, I found that because I'm the CEO of PG Partner. I just we help the biotech company and supply our BD consulting service to them. Yeah, I think for many professor in the university or the scientists in the research institution, more and more than they founded their own company outside. And what they need is just the people who have this kind of experience to help them what we do, what is in the commercialization in the future or the out licensing in the future.
Mm,
We
mm.
should know what the investor or what the licensee need first, and
Right,
then
right, right, right,
we
right, right,
we make the design. If they don't need that, we don't. Why we waste the money and the time
right.
on that? Yeah, that's the problem. So, and I think maybe you and me, we can just supply our experience and help them to know what they should do. In the future, government admit our just values, that will be okay. We can help government to do that.
Yeah, yeah. No, you're absolutely right. And we could probably spend another hour talking about this, but you're absolutely right. I mean, there are a lot of companies that have, at least in the US and Europe, that they raise some capital from investors, they have grant money, and they're developing things which, again, may be scientifically interesting, but these are drug candidates that will not be licensable
Yeah.
because for whatever reason, big pharma has moved on or treatment has evolved differently, so they're not going to be licensable. And so either they have to raise enough capital to commercialize it themselves, which is very difficult in this environment, especially when there's no IPO market, or they're stuck. And you and I have talked about this. And so yeah, I mean and that's capital that's wasted.
Yeah,
That's
with
capital that's gone.
with
It's gone. It's gone. Once it's gone, it's gone.
yeah.
You know.
Yes,
So
yes,
yeah, I I,
yeah.
I think the trend.
Only last month, a CEO of biotech came to my office, and they asked me if we can help them to do the out licensing. After I make a quick look about their project, I found it's maybe it's not possible because their IP is very because as a scientist they don't think IP is very important and but they think it's
Hmm.
very necessary. So they wrote the patent by themselves or by their students.
Oh,
So
okay.
the patent is terrible. So it cannot
Yeah.
make a protect to their project. And even they can got the authorization in the future, but it is not available for the future transaction. I don't think
Yeah.
any big farmers they will license in some projects without any strong
Oh,
international
absolutely.
protections. So I think
Yeah, yeah.
that is a good example for the BD or the marketing driven research is.
Yeah, yeah, and to bring it all full circle again, it goes. Let's come back to Hengrui.
Okay.
Not only are they very innovative. Um, to go back to what you said a few minutes ago, clearly they are, developing drug candidates that prospective licensees want. Um, And okay, let's set the Braveheart transaction aside for a moment. They've been able to out-license to Merck in the U.S., Merck in Germany, and so forth. They've been very successful in out-licensing. So that means that there's somebody there or a team that's telling the research scientists,
Yeah,
yes, work on that program. No, don't work on that program. Nobody's going to want that. Yes, they will want this. And that
yeah,
is a critical skill. It's more than just expertise. It's really a skill to have a management team that can sort of guide the research in this direction and not that direction. So again, I admire Hengrui a lot because they're clearly making some they're making some very good decisions about what the research and development team should be doing and what they should not be doing.
yeah,
So
yeah. I think Henry should have a very strong BD teams and a very clear BD strategy. I think every comparing with the other Chinese pharmaceutical companies, Henry did the work outstandingly. So I think
yeah, yeah,
they must have the reason behind it. So the first thing before they doing the clinical doing the study or doing the research, they must have a clear understanding what the project will what they will do in the future on the project, licensing out or doing it by themselves. The first one.
agreed,
The
agreed.
second is that because last year they made a new call on their project GLP-1 with a big pharma, and this year they made a new call with the Braveheart. I think they must have their the strong network in the West to the investor because yeah,
Yeah,
only when they have the good relationship with the local investor, this bigger investor, they can have this kind of the new call so quick. And nowadays, many pharmaceutical companies they have the subsidiary or the local offices in the West, in the United States or in Europe. And I think that is a good way for them to have more and more international transaction because I think the face-to-face connection is very important. Pharmaceutical company, they just send an email or make some calls with the big pharma. I don't think it's very cost effective. It's not very effective because there so many Chinese pharmaceutical company they are going abroad, and I think maybe the big pharma, maybe even each of their BD employee will receive a lot of the projects every day, and
Yeah.
so it's hard to let them know your project is good, or they
Yeah.
much
Yeah. Yeah. Yeah.
better than
Yeah.
the other
Yeah.
others. Yeah.
Yeah. Yeah. Yeah. Yeah. Yeah. I fully agree with you. They're doing a lot of things right.
More and more foreign people, yeah, maybe the people like you, who was born in the West and have a long-term work experience in the West, and they joined the Chinese pharmaceutical company, or be the partner of Chinese pharmaceutical company. I think it make the Chinese pharmaceutical company have more chance to do the deep communication with big pharma. I think that is also very important. Yeah. Yeah, their CEO, or maybe their CSO or CMO or something, or CFO or something like that. The C-level people, they have the long-term work experience in the West or in the big pharma. They have, before they joined the Chinese pharmaceutical company, they have already had the close relationship with those companies. That is
Right.
very helpful for them have the big deals.
Yeah, but it also helps, like we talked about earlier. You still have to have good drug candidates. Because you could have the nicest office in New Jersey with all the right people, but if the drug candidate's not that great,
Yeah. So the two parties is
you
very
know,
important. Yes,
it's
the
just two
first
part exactly.
you should have the good candidate, and then
Yep,
you have a good team
both
to do the BD work.
exactly, exactly,
Okay,
and they
okay,
have both. They clearly have both. They clearly
okay.
do. Well, I mean, they have licensable drug candidates. I mean, you and I both know that 90% of our job is finding a drug candidate that's licensable because otherwise, you know,
Yeah, yeah.
there's
I
nothing there's
think
nothing
for
we can
the
do.
for the for the BD person who can help them to do that, or as a BD employee in Hengrui, is very lucky, because for us
Yeah,
have a good drug candidate is the basement for us. The project is very important. We should do work as early as possible. When we do the design, we should consider about the marketing in the future. And
yeah.
yeah, it will be very helpful for future BD work.
Yep. Yep. Totally agree.
We have already talked about 50 minutes. So I think that's all. Yeah, maybe we can end our discussion today. Okay.
Okay.
Thank you. Okay. Thank you, Dr. Karras. And thanks for your generous sharing. And we had a much better discussion today than before. So I look forward to just cooperate with you in the future.
But, thank you, Alex. Again, just really interesting topics, really interesting discussion. Next time we'll have to find some other company to talk about.
Okay. Okay. Yeah, yeah, yeah. We can not only discuss about the Hengrui.
Yeah, yeah.
Thank you, Dr. Karras. Okay.
Thank
Bye-bye.
you. Bye bye.
Okay.